Worried about vitamin B12 deficiency? Never thought about it? Maybe you should worry a little bit, especially if you're older than age 60 or 65, especially if you've taken metformin. There's several other risk factors as well. Ask your doctor about it. But if your doctor says, oh, that's not a problem, or you don't really see that these days, be concerned. Tell him to look it up in the New England Journal of Medicine, or I've got a series of videos on vitamin B12 deficiency. And here's another thing. It's easy to get a vitamin B12 test from the lab, and it's inexpensive. But it also doesn't tell you anything. That's a trap that doctors and patients fall into. Here's what to do. There are a couple of things to look at. The first one is methylmalonic acid. Why test for methylmalonic acid to show a deficiency in vitamin B12? In the diagram on the bottom of this image, you see what's going on. Vitamin B12, or cobalamin, is turned into adenosyl cobalamin. And adenosyl cobalamin is a major component needed to transfer methylmalonyl-CoA into succinyl-CoA. So if you don't have adequate vitamin B12, what happens is methylmalonic acid builds up. Think about that. Now, that's an expensive test, and do I go straight there? No, I actually don't go there very often. I go there if there is significant risk factor. One of the tip-offs, though, is increased homocysteine. As you see, homocysteine has a very similar issue. Methylcobalamin is needed to change homocysteine into methionine. So homocysteine is inexpensive, and we see a lot of people with elevated levels. When we see that, those are a couple of things that we think about. Either that or just going ahead and methylating. Methylating, what do I mean by that? Do I supplement? Yes, I do. Up until recently, I supplemented with, you can find them on Amazon. Thorn Methyl Guard. It's a methylated vitamin B complex. I've recently gotten access to a new proprietary product. It's a combination of AREDS, which are AREDS is age-related eye disease supplement. It helps decrease risk for vision loss as we get older. And it's got a higher methylfolate level. So it has a combination of AREDS plus methylation supplements. Thank you for your interest. My name is Ford Brewer. I started off my career as an ER doc, and that can be frustrating because most of the things bringing patients into the ER can and should be prevented, like heart attack and stroke. So I went to Johns Hopkins for training in prevention, did well, ended up running the program, trained dozens of docs there, and have trained hundreds and even over 1,000 doctors since then in preventing disease. What's even more important is I've helped thousands of patients prevent heart attack and stroke rather than waiting for the devastation and hoping for a cure.